with national health insurance, what I like is that we all are rolling out and learning of NHI together as we go on. So it's not like I know more than you and you know more than me. And it's important that we do it that way, so we build this thing together from the ground. National health insurance as an overall issue is something to help us to deal with universal coverage according to the Sustainable Development Goals 3, where you don't want financial barriers to be a reason why persons don't access care. The issue is, how do we do it, and what mechanism do you use? There are lots of mechanisms, but we have decided to use the mechanism of a national health insurance, where different funding entities pool together resources, so that patients can access those resources when they want to access care. Where we are right now, we are at the place right now where we have made a decision what mechanism we'll use, which is national health insurance. You also know that. We are at the point where we now have all the technical persons and expertise that are needed to consult and put a national health insurance together. We have them now on board. You also know that too. So we both know the same thing at the same time. What is the next stage? The next step is to identify how much it's going to cost to roll out national health insurance. In other words, how much it's going to cost to offer the basket of care that we hope to offer. Do we know that yet? No, we don't. Do you know that yet? No, you don't. So you see, we are on the same level. What we don't know, you don't know. What I can tell you, however, is that particular issue is what is now being researched and studied. We have on board the UE, Health Information Unit, and also an actuarial company that is helping us with that. As soon as that information become available, both you and I are going to know it at the same time. And that's the kind of a partnership and collaboration that we want to use to get along with the national health insurance, because we realize it's going to take a long time to roll this thing over. And so we don't want to go ahead and roll this thing out and get all this information and just throw it at you and ask you to accept it. We prefer that we get a chance to do this together. People are not getting registered yet, but the concept is that there are some administrative things that could be done while you're waiting for knowing what the costs and things are. We don't have to wait until all the information on costs comes forth before you start registering people to know that they are available and so on. These are things that we believe could happen simultaneously. A registration doesn't mean that you have health insurance available to you. It's just having you in a system so that when we have the insurance rollout, we already are ahead in terms of identifying who people are and where they are. Integration of private insurance into national insurance, I can see and has been discussed, it can be a hand-in-hand situation where persons are allowed to have their own private insurance, because national health insurance will not be able to cover every medical request someone has. There is a basket of care that we believe national health insurance will be able to provide. If your desire is to have something above and beyond the basket of care, that is where I believe your own personal insurance can come in and buffer that difference that you want. For example, if you go to Dr. X and you want a procedure, Dr. X charges $10 for that procedure. Under national health insurance, you may be able to get a percentage of that. Let's say $5. We will pay the $5 under the national health insurance. Your insurance now will be expected to cover the difference. And that's the kind of mechanism we think is going to work.